That's great, thank you. Good morning, everyone, and welcome to our webinar today, which is around our strategy for 2021, a smarter regulation for a safer future. My name is Rosie Benneyworth. I'm the Chief Inspector of Primary Medical Services and Integrated Care. I'm a GP by background, and I've had a very long-standing interest in how we join up care for people who use services. Apologies, we're starting a few minutes late. As with everything, the joys of technology, sometimes it just doesn't quite play as it's meant to, so apologies for that. So if we could go to the next slide, I've got a team supporting me today. Charles Rendell is our strategy manager, who has been leading a lot of the work around the thinking around integrated care. And we've got Sarah, Steph and Abigail, who are also supporting us today. So in terms of what we're going to cover today, if we could go to the next slide, please, Steph. We're going to be talking today about our strategy, and particularly around an area of a strategy we want to talk about our work in systems. We will do our best to answer all the questions on this topic as we go through the presentation. We're going to have question breaks throughout where we can listen to your questions and I can try and answer them. But we might not be able to answer all the questions, but we will be following them all up. All of your comments are really, really helpful. We do want to hear them. And then if there's if you could post your name by any questions, so if we don't get a chance to answer them specifically here, we will get back to you with the answers for those. Unfortunately, the way that this is structured, because we've got a large number of people on the call, unfortunately only myself and the other CQC presenters will be able to speak, but do put everything you want to in the chat. The other thing, just to let you know, is we are recording this webinar, so for the benefit of people who are unable to join. So if we could go on to the next slide, please. And I just wanted to revisit where we are with our purpose and our vision. Some of you might have heard us talking about this if you've joined previous webinars, and we'll be getting onto the new content in a few minutes. But just to reiterate, we absolutely want to make sure that our health and care services are safe, effective and compassionate, and we want to encourage them to improve. Lots has happened over the last few weeks and months. The world is in a different place than it was back earlier in the year, but actually our purpose has not changed, and regulation is more important than ever during this period of time. Our vision going forward is to be a world-class regulator, able to drive improvements in how people experience health and care services, working towards a safer future. We regulate a whole range of different services, from hospitals to care homes, online services, and it's more and more visible as to why our work is important. We want the way we regulate to be simple, based on strong open relationships with providers, and to be more effective by focusing our actions on the areas where we can have the biggest impact on people's care. I think we've all learned an awful lot during the pandemic, and we know that we need to work in new ways to keep people safe and ensure world-class regulation that's ahead of the challenges that we might face. And we can only do that if we change and transform. Everywhere is changing and transforming, care is evolving, people's needs are changing. And we need to make sure that we keep and enable people to have safe care in all of the services they use. So we're reasserting and strengthening our commitment to our purpose with determination to take what we know is good in our current approach and evolve our regulation in a way that creates a safer future for people who need care. And we want our regulation to improve people's lives. So if we could go on to the next slide, please. So I'm sure everyone on this call knows that health and social care is changing at a rapid pace, and more so than ever over the last 3 or 4 months. We know people are living longer, people have more complex needs, people need multiple providers often across the system. We know that the way health and care is organised is evolving rapidly. We're moving towards integrated systems, looking at primary care, secondary care, social care, all working together in different ways. We know there's lots of different new ways of working with technology, and that has really transformed, particularly in some sectors, over the last 3 or 4 months. And we also know that there are limited resources, and we need to make sure that that those resources are used in a way that enables safe, good quality care. So we're expecting that this change is going to continue rapidly, and in the response to that, we need to be flexible and we need to be agile in our approach to regulation. We know that we don't always get it right. We need to judge our own success by those who we regulate, and if the health and social care system is not providing people with consistently high quality care, then we need to look at ourselves to improve in order to help providers improve. And we need to think, what can we do that's going to make this better? We think a smarter way of regulating will help us identify more quickly and consistently where to target and when to keep people safe. And it will also help to reduce and streamline the requirements that we make of providers, something we hear from providers on a regular basis. We've got to be more relevant and responsive. We need to match our pace of change to what's happening in the outside world. Innovative ways of delivering care continue to emerge, as we've talked about, and as we transition, the current sectors are going to look very different, and we've got to respond to that in an agile manner. At the moment, we don't have a full picture of care across an area, a system or pathway. And actually what we know is that people don't often experience care in one provider. They go from provider to provider, or multiple providers are involved in care. And often, and I've seen this on many occasions in my work as a GP, often people's care falls down in between those providers. It's those interfaces between providers that is really important, and we need to be thinking about that as we move into our next phase of regulation. And finally, our people need the right tools and capabilities. We need the right technology, we need the right systems, we need the right skills, we need the right culture, and we need to be able to test things and innovate and work with people to be able to regulate effectively. And we've got some great examples of how we've done this over the last few years, and things like the sandboxing work we've done with digital triage and various other pieces of work. We need to continue to evolve and develop. So if we could go on to the next slide, please, Steph. Thank you. So just to explain some of the learning that we've had from the COVID crisis. So we know this has been a hugely challenging time for all providers, and we know that it's not over. We know that for many providers the challenges continue, and actually in some providers those challenges have only increased over the last few weeks as the situation changes. During the early stage of the pandemic, we moved very quickly to adapt how we regulated and worked within the health and care system. We were very keen to support providers to keep people safe and allow them to focus on the emergency, avoid our inspectors spreading the virus inadvertently, particularly in those environments, the closed environments, and also reduce demand for scarce PPE. So at that stage, we paused routine inspections in the middle of March. However, during this period of time, we haven't stopped regulating, and we continue to work with lots of partners, identify areas of concern, listen to whistleblowing information, safeguarding information, and other information from other people using services and people working in services and working with services. And we've increased over the last few weeks our responsive inspections as a result of that. I think we very much encourage people to give feedback on their care using our Give Feedback on Your Care service, and we listen to that and we look at that information, and that's really important to us. And our work collaboratively with system partners, both locally, regionally and nationally, has been really important, and that's informed lots of our decision making and our ability to respond to risk. We set up an emergency support framework, which is a new monitoring tool, and this has enabled us to have supportive, open, honest conversations with providers to see where providers need support, how we can signpost them to that support, what challenges they're having, and we've been able to look at helping resolve some of those challenges both at a local, regional and national level. We've also introduced the home care tracker in adult social care, and this tool is designed to complement what's available in the NHS tracker it really help us inform what's our understanding of some of the risks around social care and the quality of care. And we're very keen that we share learning. We think it's really important that we transparently share what we know, and we think it's really important to improve the quality of care for everyone. So we've begun, and we will continue to publish a series of insight documents intended to highlight the COVID-19 pressures on the sectors that the CQC regulate. Do have a look at these. They're really interesting, and they're different themes every time. And it draws on information gathered through our own regulatory activity, direct feedback from staff and people receiving care, new data collections that we're doing, and also insight from other partners that we work with. And this information is really we're collecting to look at the wider impact of COVID and to share those regular updates. And we work closely with the Department of Health and Social Care, and we're wanting to identify any emerging trends, any issues to help inform the country's response to COVID-19. Just moving on to the second slide. Next slide, please, Steph. So I think I've covered a lot of this, but I think some of our learning is that from the last few weeks is that information sharing between partners is absolutely critical if we're going to provide good care, and that needs to be at every single level in the system. We need to listen to the voice of people. We need to understand how they feel and what they would like to see from some of the transformations that are happening in our health and care system. An example is the digital work that's happening in primary care, and we know that a lot of patients find it improves their access and it helps them get care from their primary care teams, but we know that there are some people who find that more difficult to access and that struggle with technology, or for various reasons it's inappropriate, and we need to understand that. And we also need to understand from care providers what are the challenges that people are having, how can we support those, and how can we make sure that we support providers to deliver safe care. We'll talk about systems. I think it's been fascinating over the last few weeks and months, and I think really important lessons that we can learn from the last few weeks and months about how systems work together, and I'll come on to that in a minute. And finally, I think one of the key things that we feel over the last few weeks, but we absolutely want to promote going forward, is transparency. This promotes learning. We need to get to the point where people transparently share data, where they share things that have gone well, where they share things that haven't gone well, and we learn from it, because actually, unless people are transparent, we're going to and open about what's happened and are prepared to learn from it, we're not going to be able to equip ourselves with meeting the challenges going forward. So a couple more slides and then we'll go into questions. There's a lot we're doing about our strategic direction to design a future operating model for the CQC. We've got 4 strategic themes that are emerging. And we're going to be developing a new operating model to do that. And in order to make our strategy a reality, we've got to transform, we've got to build foundations for ourselves, to build the systems and processes within the CQC that will enable us to use data in a different way. We've got to be able to get a dynamic view of what's happening in the quality of care, and we think technology will help us to do that. We need to continuously improve ourselves as an organisation. We think it's really important that providers develop the cultures that actually improves and enables them to continually improve. We need to do the same, and we want to keep the pace of what's happening in the health and care services. We do not want to be a barrier to innovation, and we want to develop the way we work to enable those innovations to happen, because they're really important for people who are using services. We just need to make sure they happen in a safe way. And then as we adapt and evolve, we will be looking at creating our future so that we can have a strong implementation plan to be able to deliver our strategy. We've made huge progress since our last strategy in 2016, but I think we recognise there's an awful lot to do. And we want your involvement in all of this. This is the fifth webinar we've had around the strategy, and we've heard an awful lot of really useful information, and we want to continue that engagement to build how we do. If we could go to the next slide, and this briefly talks about the timeline. That's brilliant. So of where we are, and so we want to go out to consultation in the winter, this winter, with our strategy, and we want to continue over the next few months to co-design what we do, so that by May next year we are in a position where we can actually publish our strategy and implementation plan and get going as quickly as possible. So the next thing I want to talk about is systems, and this is why we're all here today. And I want to talk, we want to hear your views about systems. Let me just explain a little bit about what we've done and what we're doing at the moment, and then we'll have some questions. So with systems, as you may know, we did a series of local system reviews 2 or 3 years ago and published a report in Beyond Barriers, which really showed how what the characteristics of systems should be to work together and to look at how they deliver care for families and their family and their carers. I think what we've seen through the last few weeks and months is some brilliant innovation across local areas. And we've seen some really great collaborative approaches where people have come together to actually really think about the care they're giving for people during COVID. We've also seen some areas where that hasn't worked, and there hasn't been the collaboration that is required to deliver these people's needs, what people need in these changing times. We want to conduct, or we're in the middle of conducting, a series of provider collaboration reviews, and this is looking specifically what's happened during COVID and how do we capture that learning very rapidly so that we can use that learning and encourage other systems to think about that learning before any second wave or before a winter, which we all suspect will be a very difficult winter. So if we could go on to the next slide, that would be brilliant. So we're setting out some provider collaboration reviews. I've shared the objectives on the screen, and I just wanted to highlight that these are really about learning. These are not in any way about blame. It's not in any way about kind of wagging a finger at anyone and telling them off. This is about learning, and this is about how, as a regulator, can we support that really important work between providers, sharing that really important learning from this period of time, so that actually we can do all we can to support the system going into the next few months, which inevitably will have their challenges. If we could go on to the next slide. So what we're actually doing is we're going in phase 1 into 11 areas. and those areas are listed on the screen. And we pull together all the data that we have in those local areas across all of the sectors that we regulate. We pull together any data that we can access otherwise, and we have a series of interviews with people in those local areas, and we're trying to be as inclusive as possible with those interviews. We want to hear the people who use services, their voice. We want to hear it from primary care, from social care, from hospitals, community care. We want to hear everyone who's involved in delivery of care, and we will pull all of that information together. And this phase we're particularly looking at how have health and social care work together to look at care for the over 65 population group. And as you can see from the list we've got there's quite a wide range of different areas. We've pulled on lots of different data to say, can we have some rural areas? Can we have some urban areas? Can we have places that seem to have had higher mortality rates and lower mortality rates, places that have got different demographic makeups, and so we get a really broad understanding. This is phase one. We're hoping that we are able to continue this to further phases, possibly looking at different population groups, and we would like to get to all systems and do that in the next few months. Phase one, what we're doing is we're actually sharing the learning back to the local systems. We're not publishing reports on the local systems at this stage. We're sharing reports, sharing some feedback back with the local systems. We will be publishing a national report, which will not identify any of the particular systems unless we've got permission from the individual providers to do so. And that national report, we want to really pull out the themes and the learning so we can improve care for people going forward. So now, if we could come to the next slide, please, Steph. So this is the opportunity for us to look at some of the questions you might have posed. So we want to think going forward about what's our role in systems. So we've got lots of different thoughts, but we'd like to hear your thoughts. You know, should the CQC have a role in systems? What should be the balance between providers, our work with providers, and our work with systems? Should we work with commissioners? How should we work with commissioners? What should our role with commissioners look like? And what does it mean if we look for systems for people who use services? So, so I'm going to stop there for a moment, and I think, was it Sarah's going to, I think, go through some of the questions and call some of them out to me.
Yes, so we've had a couple of questions around what is meant by a world-class regulator. So are the standards that CQC will be working towards, and what research evidence are we using to inform what it actually looks like?
Yes, very good question. So and this came up on the webinar I was doing yesterday as well. World-class, I mean, essentially it's what it says on the tin. We want to be leading the way in regulation across the world, and I think in some areas we already do that. We work very closely with regulators across the world, understanding what they're doing, learning from each other, and thinking about how we can continually improve what we do. I think we want to set ourselves that ambition as to what world-class, as to becoming a world-class regulator. How we define that, how we measure that, is discussions that we need to have. I think we need to pull on data about how our regulation compares to international regulators. I think we need to particularly look at actually how does our regulation impact on the people who use services. You know, I'd love our services to be world class for the people who are using them. I think we should be ambitious. We should think about how we get all of our services and support all of our services to improve. Everyone deserves great health and care, and we need to be really being ambitious in what our aspirations are. terms of how we measure it, I think we wouldn't use one measure, we would use a variety of measures, including what does it look like for people using services, what does it feel like for providers, how do we really drive improvement through what we do, how do we really support system working, all of those things. I think we would want to develop a series of measures to be able to judge ourselves, and I think the other thing to say is, being a world-class regulator, we would never ever get to the point where we'd got there, because actually a world-class regulator would need to have a really great improvement culture where we continually strive for improvement internally in our organisation and externally with what we do. And in the same way that we want to develop that improvement culture in all of the providers that we work with, we need to be championing that and leading the way in actually how we have the best improvement culture.
Thanks, Rosie. And there have been a couple of questions around the PCRs. So one question about whether independent sector providers will be included in the PCRs, and also there was a question that I think comes down to selection. So this particular person asked why Cornwall hadn't been included, considering that the over 65 age group is growing in that area faster than anywhere else in the country, and there's only one main hospital. So I don't know if you can say a bit about maybe how we selected the PCR areas for this first round.
Yes, certainly, and you know, in an ideal world, we would have gone out in the first round to do all of the areas, because I think they've all had challenges, they've all had some brilliant ways of working, and each system has got a lot of things that are similar, but a lot of things that are different, and actually that's some of the learning we want to capture with the PCRs. So what we did was we looked at all of the data that we've got about the different systems. And then we really tried to pick a selection of different systems based on, like I said, trying to get a geographical spread. So we tried to get one area at least in each of the 7 NHS regional footprints. We looked at things like the mortality rates, and sort of areas with higher mortality rates and areas with lower mortality rates, because we want to see if there's any differences, and the kind of COVID rates. We looked at ethnicity of the populations, because we are aware that, very sadly, COVID does seem to have a disproportionate impact on our BAME communities, and so we looked at looking at different kind of contrasting areas with different demographics in terms of ethnicity. And so we looked at a whole range of things that we felt would give us a snapshot of what was happening across the country. Now, Cornwall, we'd love to come to Cornwall at some stage, and we will. Like I said, we want to very quickly go into a second phase of these reviews, and our ambition is really in the next few months to get to as many as possible. So I think if you haven't seen us yet in your local system, then we would love to come in the near future and just watch this space, because I think it's something that we feel is very important. Oh, you mentioned, Sarah, sorry, just to answer the question about independent sector providers. I think that when we're going into the local systems, this is a kind of rapid review, so we are looking as much as possible in what we can in the local systems. Certainly, probably at this stage, some of the larger independent sector providers, if we can, we will be looking at. I think you know, at some stage that's something we will evolve as we go forward as well, but it probably depends on the type of provision that those independent sector providers are offering at the moment.
Thanks, Rosie. And then on systems, we've had a few questions and comments around how will CQC take into account the pressure that's on providers, and the mounting pressure and underfunding in certain parts of the sector, and I don't know if you want to answer that, and then we can come to a couple of the other questions on the systems as well.
Yeah, certainly. So that we are aware there's enormous pressure on providers at the moment, and we do absolutely recognise that. We have regular conversations with stakeholders in every provider group that we regulate. Certainly, I've spoken to probably 100 GPs this week, and through various forums, and I have very regular contact with all the people in the sectors that are in the areas I regulate, and likewise my colleagues are the same. So we are very aware that the pressures in providers, we know that there's been a huge amount of pressure to date, but we also know that those pressures are in some areas not reducing, and as services are being encouraged to resume back to more of the routine work, and as people are demand is coming from more patients who are feeling more confident about using services, I think there's a lot of services under huge demand, and so we absolutely recognise that, and we absolutely want to support providers and work with providers to ensure that they can deliver really good care. So there's a variety of things we're looking at. One is we're looking at, for example, how can we do some more work remotely? So for example, in primary care, we're looking at, is there a way we can actually access IT systems and things without being on site, so we minimise the disruption on site. We're looking at developing a new kind of regulatory transition methodology as we go back in, which will be a kind of slimmed down version of methodology, still looking at the 5 key questions, but making sure that we really can identify those areas of risk and really identify what matters to people, and without involving a huge amount of the provider's time, because we know that that is very precious. I should also just say that the remote, the provider collaboration reviews we're doing remotely, we're not on site, so we really do not want to have a negative impact in any way in terms of people's time where we can avoid it. However, our responsibility, I will just say, our responsibility is to the public and people who use services, and we need to make sure that people do have access to good, safe services. And so if there are concerns that are raised, or if there are things that we're worried about, then we will go and look, and that may have an impact on the pressure in a provider. But our role is to make sure that people have safe services, and that is something we will absolutely be following up on, and make no apologies for that if we're not confident that services are safe.
Thanks, Rosie. And I think building on that, there's some questions around what influence CQC can bring to the interoperability between health and care systems who operate on different systems. I'm wondering whether this is specifically kind of IT systems which don't speak to each other, and also a question around how and whether CQC sees itself as an expert in kind of looking at systems and developing systems. Okay,
so I think there's 2 separate questions there. So in terms of the IT interoperability, we will be shining a light through the feedback that we give on IT interoperability, and information sharing is something that we will be looking at as part of our provider collaboration reviews. We think it's really important that information is shared in a timely way, and that systems work together to be able to do that. And so we will be asking those questions, and we will be feeding that back locally. But if there are themes that we're seeing that need kind of a national response, we will certainly be feeding those into the national report to raise the profile. And we'll also be raising our profile in our State of Care report, which is an annual report we do, which very much is to look at how we can influence all of the stakeholders across the country to improve care. In terms of systems-wide work, we do have some capability and some expertise within the organisation already, which has been built up over the last 3 or 4 years with our work on local system reviews. We want to build and grow that capability, and certainly if it's something that we proceed with in our work, then absolutely it's something that we will continue to grow. And I think actually we need to help to develop our workforce to understand how they meet the changing needs, because actually from my experience in system working, and I've been working cross system for donkey's years, I was a clinical commissioner for many years before I came into this role, and I think, you know, we need to support our teams to understand how things are changing and what that means, and in terms of what they do, but certainly we do have a lot of expertise already, and we will be looking at building that. We're not, you know, I think we want to work with partners as well to understand what expertise we need and what expertise we might not have, and then be able to develop it. And we'll be working very closely with system partners across both health and social care to really understand that. Sorry, Sarah, just to add to that, the other thing I should say is that we have a long-standing history of bringing in expertise to support us with inspections and support us with our regulation across all of the sectors. So whether it's our specialist advisors that come from all sectors, or our experts by experience, so we will be having an ongoing consideration about how we make sure we get that expertise if we don't have it in-house.
Great, thank you. And I think one final question before we move on to, I think there's some more slides, and we can come back to questions I think at the end as well. But one we've had is around whether there'll be any impact on the Chloes. So I think this is generally whether the strategy and the themes that we're looking at will have an impact on the Chloes. Yes is the likely answer, and we're working through what that will look like. We know that at this stage we want to keep the 5 key questions. We think it is important, those five areas. So is care safe, is it effective, is it responsive, is it well led, and is it caring? We think actually they're really good 5 areas that do give that rounded view of quality. But there's no doubt that our Chloes need to, we will be looking at that, we will maybe streamlining them, we may be adapting them and changing them so that we are absolutely sure that we are meeting people's needs, and we are capturing things that are important to people who are using the services. So there is likely to be changes as we go forward with our Chloes. Okay, shall I move on to the next slide, if that's okay? We've just got a couple more slides to go through, and then we'll have some more time for questions at the end. So as I've alluded to on several occasions already today, putting the public at the heart of what we do is very important to us. It's absolutely why we're here. It's absolutely what our organisation is about, and it's really important that we do this both at the individual service level, at a local level, at a regional level, at a national level, and with everything we do, we want to absolutely make sure that we put the public at the heart of what we do, and we want to hear more from the public. We want to hear feedback, we want to hear what's going well, we want to hear what's not going well, and we have a variety of channels for people to do that, and so do encourage people to feedback on the care that they receive, and do encourage people to get involved in the discussions with us, because it is vital for us that the people who use services are the people we need to hear from, and continue to work with them so we can make sure that they get really good quality care. So if we could just go on to the next slide, if that's okay. So just finally, I just wanted to firstly say thank you for all joining today, and this is really important to us. We want to hear from providers, we want to hear from
we want to have the best kind of feedback and information from people so that we can continue to improve what we do. And there's a whole variety of ways that we want to hear from you. So please do use our Twitter account. We've got teams that monitor that and feedback all the themes. We've got a provider bulletin that actually went from monthly before coronavirus, and then for a period of time went weekly, but is now twice a month. And we've also got a digital platform called Citizen Lab, where people can actually give their feedback on particularly on the themes of the strategy and areas. So please do continue this conversation and do get involved. We're all learning together at the moment, and the more voices and the more thoughts we can have, the better. And I think my final slide is just for any further questions. And also some ways of contacting us. So Sarah, are there further questions?
Yes, we have a few more. So let me just have a quick look through. There are some further questions on the PCRs, so around whether hospices are included and children's hospices as well.
Okay, that's a good question, and Charles, one of my colleagues, might be on the call at the moment. Charles, are you able to answer that?
Yeah, hospices have been included. I don't think we have specifically asked around any children's hospices because we're looking at the over 65s in this group, but other hospices are included in this round of the PCRs, and we have spoken to the Association of Hospices and a couple of the areas where we've already done PCRs have been very keen on us to engage with the hospice services that have been there during the COVID period.
Great, thanks, Charles.
Thanks. And we've had a comment that so coronavirus has demonstrated the power of community, and there's increasing engagement of the voluntary and community sector in the provision of services, including the use of volunteers. How do we engage volunteers in regulation without increasing burden to both the volunteer and the statutory providers?
That's a brilliant question, and I think we've all seen those fantastic examples of you know, where volunteers have played a really significant role. And we had a similar question on the call yesterday about people who are lonely and the support locally that had been given to people with experiencing loneliness, and the work that had happened with volunteers. So it's a good question that I don't have a specific answer for at the moment, but I think it's something that we do need to think about as we go forward in terms of our regulatory work, and particularly as we go forward in terms of thinking about working systems. How do we really reduce inequalities? Because I think the voluntary sector also has a key role to play there. And how do we look at those wider determinants of health across a system, and look at how local communities bring together all of the resources in that local community, whether it's the voluntary sector, the local councils, the people who support people around jobs and housing, and all of the other things that we know are key determinants of health. And I think that's something we need to think about and reflect on as we go forward with our future regulation, and think about and work with other regulators in the area. We don't want to put a huge additional burden onto the voluntary sector. We know that many of them actually are you know, resources are often very scant, and we know that the voluntary sector often, you know, it's been a challenging time as well for that sector. But I think what we do need to think about is if people are involved in delivering care for people, how do we make sure that governance arrangements are good across the system, how both, you know, locally and on a bigger footprint, so that actually everyone is clear about things like accountable. Who is accountable for the care that's being delivered? Who makes sure that people going through those different models of care, if they involve various people in delivery, including the voluntary sector, who makes sure that those people going through those services are safe, and that there aren't gaps in those different ways of working that people are going to come to harm in. So a good question, and it's something certainly we will be working through with our system work.
Thanks, Rosie. We have also had a couple of questions around our plans to improve our image from being so questions around how we what are we doing to kind of improve our image to being a positive, supportive organisation that's part of the system and supporting improvements, and kind of seen as sharing learning and being honest and open?
Yeah, so again, another really good question, and I think we absolutely want to develop those mature relationships between ourselves and providers and all parts of the system, because we do need to be able to we absolutely want to drive that improvement. It might not be us doing the improvement, it might be other people, but we absolutely want to drive that improvement in providers. We want providers to be able to phone us up and say, look, I'm really worried about something that's happened, or you know, how do I deal with this, and have that communication with their inspector, and to be able to really feel comfortable about doing that, because actually ultimately that's the kind of environment and culture that we want to promote. We want people to be open, we want people to raise concerns, we want people to learn, we want people to reach out and be externally looking, so that actually they can learn from what's going on elsewhere. Our teams are in a really good place because they see lots of really great care that can be shared, they see care that's not so good, and we can share the learning from that as well. So we do need to establish those different relationships. I'm really keen that we develop those really mature relationships, that we're really clear about our role. Likewise, though, I think we do need to make sure that we continue to take action on things that we need to, but we do that in a very transparent way, so people are aware why that's happening. People can see that we're dealing with problems that actually that there isn't any other solution to deal with, and that we're taking action that's going to protect people from harm. But we need to do that, and we strive to do that in a very open and transparent way, and strive to do that working with all of our partners across a local system. The other thing to say is we're building over the last few months, particularly we've had good relationships before with our key partners, but I think over the last few months there's been some brilliant partnership working with ourselves and NHS England and CCGs and various other parts of the system, and I think we need to build on that and continue those conversations as we come into the next few months.
Thank you, and I think slightly building on that, maybe in a similar kind of vein, the question around consistency of our inspections, and whether there'll be a standard for kind of our regulation, our inspections, and a suggestion whether a better solution would be to rotate inspectors, so not allocate one inspector to a provider. And a question around whether it would be more impartial if the CQC inspector team drew upon independent professionals. I don't know if you've got any comments around that.
Yeah, certainly. So consistency is a theme we talk about very often, and we're really keen that we are consistent, and we continue to look at consistency so that the public who use services can be confident in terms of our judgments that we make about providers, so that the providers themselves can have confidence in the processes. There's been a huge amount of work that's happened in consistency over the last few years, and certainly there's been significant improvements over the last few years. I think we all recognise there's more to do, and particularly looking at consistency across the different directorates and across the different sectors. And I think we've recognised that, and that's something we're talking about with our new target operating model, our new work to transform our organisation. We think that technology can play an enormous part in that. We think that there's opportunities with how we use data to improve consistency. So we think there are a lot of opportunities. It's an interesting one, and it would be good to hear views about, you know, do we have the same inspector? Do we have different inspectors? There's pros and cons for both. Certainly, one of the things that we've found having the same inspector is that actually it does help to build those relationships and start to build those more mature relationships where people can have those dialogues on a much more often basis, so that we can kind of deal with some of any of the challenges that arise at an earlier stage, and we can work with the provider to look at how we improve things. I think it's absolutely key that we continue to get specialists in areas, excuse me, and we get so for example, we use in the sectors and in primary medical services, we bring in GP specialists, we bring in dental specialists, we bring in specialists who really understand the subject area, and that helps give a kind of really good view of what's going on. So I think it is something that we are very aware of. It's something that we are continuing to work on and will continue to work on as we go forward.
Thanks, Rosie. And we've also had a question around the ethnicity data that we ask providers collect, and what we're doing as CQC to make sure that we as an organisation are also diverse, and considering that health and social care is provided by lots of BAME staff, and what are we doing to address any, you know, is there a subconscious bias within the organisation, and what are we doing as an organisation to address that?
Yeah, and really, really important question. So thank you, whoever raised those. So there is a lot of work going on in the organisation around this, both in terms of ourselves as an organisation, because we recognise that we've got improvements to make, and we could be more diverse across the organisation, and we recognise the importance of it. You know, this isn't for me about numbers and data. This is about, actually, it's vital that we get that diversity as an organisation, because actually we will be so much richer for it, and we will have so much more diversity in our thinking, and so much more diversity in actually how we approach our work. We were fortunate actually to have Matthew Syed to come to talk to us, who's written a fantastic book called Rebel Ideas, and I'd thoroughly recommend it to those who haven't read it, about that importance of diverse thinking and things. So as an organisation internally, we just have recently launched a new diversity strategy, and we have a team working on that, and we have a whole series of actions around that internally. We also have a whole range of work looking at actually how do we promote equality and diversity in what we do externally with organisations, and we certainly can share more information about that if helpful.
Great, thank you, Rosie. And I think probably got time for one final question, and we've just had a couple of questions which I think are probably for clarity around. There was a reference to accessing IT systems, just a bit of clarity about what you mean by that, and who is doing the accessing and which systems, if possible.
Okay, so this is something we're exploring, and I'll just talk about general practice at the moment, because that's the area we're looking at. So in general practice, we're exploring, and we've done a pilot where in practices where we're concerned about risk, we've been able, with the practice's consent and with all the correct information governance arrangements, we've enabled our specialist advisor on an inspection to access GP records, which has meant that they haven't had to go on site, and that they have been able to look at areas of concern and look at what's going on. Now, this is very much in kind of very strict parameters of the practice knows when we're going into the records, the practice knows when we're coming out of the records. So we're not kind of constantly dipping in and out of lots of different records. This is very much with the working in conjunction with the practice. But to avoid some of that kind of impact that a team of inspectors has by turning up at a provider, so that's something we're testing out at the moment, and I think there are opportunities for us to look, given the circumstances at the moment, as actually are there things that we can do that don't involve us being on site, that we can do in a different way, that actually are more efficient, equally as effective, and don't have a kind of an impact on the provider, who we know are all busy at the moment. So those are early days in our thinking, but work that's progressing, and we'll certainly be communicating more as plans progress with that.
Great, thanks Rosie. I think that's probably all we've got time for, but just to say that we are, we've logged all of the questions that we've been asked, and we will be looking to get back to as many as possible. And if you feel that your question wasn't asked or answered, and you'd like some more information, then you can email us. We'll be emailing out the slides after this, and you can respond to that with any questions that you have.
Thank you, Sarah, and thank you all for joining us today, and please continue this conversation with us, and I hope you have a great day. Thank you very much.